Welcome to our Primetime Alive program, over-the-counter medications and older adults. If you need more information about our program, either to join or to sign up for a program, you can go to mgmc.org/PTA. All right, our presenter today is Ellen Heikens. Ellen is a graduate of Drake University College of Pharmacy and Health Sciences. She has been a pharmacist at Mary Greeley Medical Center for 8 years, but will actually celebrate 10 years with us this June. She started here while she was still in school, so she has been with us almost a decade now. She has certifications in pharmacogenomics and anticoagulation, and is a preceptor for both pharmacy students and residents at Mary Greeley Medical Center. Please welcome Ellen.
Hi. So like Becky said, my name's Ellen. I'm one of the pharmacists here at Mary Greeley. Right now I work primarily on the medical telemetry floor. So if you're ever there, you might see me. I mostly do patient education up there. Today we're going to talk just for a little bit about over-the-counter medications and older adults. So let's just get to it. I have a few objectives. Obviously, with my residents, we always want them to have objectives for their presentations. So here are mine for this presentation. By the time we're done here, I just want you to guys understand more about maybe using over-the-counter medications safely. Really, I hope that you feel more confident when we're done. When you're out in the grocery store buying over-the-counter medications, kind of knowing what you're looking for, how to read the labels, everything like that. We'll cover really briefly maybe some non-medication options that you can consider when you're treating any kind of condition. And then really quickly with each section, we'll talk about when to not treat over the counter, or maybe when we've reached the limit of treating things over the counter and you would want to go see your provider at that point. So really briefly, just a few items for clarification. We're going to talk only about older adults and over-the-counter medications. Generally, I will usually only use the generic name of the medication, but the brand name is usually provided on the slides just for clarification. Most of this presentation focuses on single drugs or single ingredient products, and I will talk a little bit about combination medications as we go, but I'm not really going to talk very much about those combination products like, NyQuil or those ones that have 3 or 4 ingredients in them. We're going to focus on single ingredients and how to select those ingredients for whatever we're trying to treat. I really have no preference for any generic manufacturer over the other, any brand over a generic. There's lots and lots of pictures in these slides. And really, I just kind of want you to get a feel for what it might look like as you're looking around in the over-the-counter aisle and kind of how to spot the things that you're looking for. I'm not going to really talk about anything regarding like therapy for children. Obviously, this presentation is focused on older adults, and I'm not going to go over specific dosing of products. We will go over how to read the label and figure out how to dose those products yourself. I promise you don't want to sit here and listen to me regurgitate doses of medications over and over and over again. And then, yeah, like I said, feel free to ask lots of questions. People generally have lots of questions about this topic. I want you to feel, like I said, confident about over-the-counter medications when we're finished. So yes, please always ask questions. All right, here we go. So what makes a product over-the-counter versus a prescription medication? Prescription medications usually require medical supervision to be used, so your doctor might want labs or to see you every 6 months while you're using that product, whereas over-the-counter medication is usually safe to just use by yourself. Over-the-counter medications have to have low or no potential for misuse or abuse. Probably the biggest exception is pseudoephedrine, and that even you kind of have to buy behind the counter, even though it is an over-the-counter item. Prescription medications usually do have some potential for abuse or misuse, or as we get into like our control medications, can definitely be misused or abused. Just a few other things. Over-the-counter medications, in order to be considered over-the-counter, they have to show that the benefits of therapy outweigh the risks of using them by yourself without supervision. And there are some prescription medications that are just over-the-counter medications at higher doses. An example I see a lot is ibuprofen. You can buy 200 milligram ibuprofen tablets over the counter, but if you get like 600 or 800 milligram tablets, those are prescription only. So, reading an over-the-counter medication label. So, over-the-counter medication labels are standardized, and that's from the OTC Drug Facts label regulation in 1999. So, they have a standard format, their standard content requirements. It has to be in simple language. It has to be easy to read. The type has to be large enough to be easily read, which don't really believe. And so that's why, too, you see sometimes they have like the little fold out things on the side because, yeah, there is a standard size that it does have to be. And then if it does look familiar, that one is patterned after the nutrition food facts label. So if you're used to reading those nutrition facts label, this should feel halfway familiar to you. The first thing that they need to list on the over-the-counter medication label is the active ingredients and the amount in each dosage unit. So it'll say, ibuprofen, 200 milligrams. That should be about the first thing that is on the label usually. Underneath that, they will have the uses for the product or the purpose for the product. Underneath that, they have the specific warnings. The specific warnings will cover when the product should not be used, when the product maybe has reached the limit of its use and you need to consult with a doctor or a pharmacist. Those specific warnings should also cover the potential side effects, and it should also cover any kind of drug interactions or substances or activities to avoid while you're using the product. Next, it should have dosage instructions for you. So it should be fairly clear on the label when, how, and how often to take the product. Then underneath, it will say handling and storage information, usually just says room temperature or controlled room temperature. And then underneath that, there should be inactive ingredients. So if you have specific allergies or anything to any inactive ingredients, that should be findable at the bottom of the label. So what about older adults and our over-the-counter medications? What are some considerations as we get older that we have to think more about when we're selecting medications, even prescription medications or over-the-counter medications? So first in our body, we have a blood-brain barrier, and that generally keeps medication from reaching our brain as much as possible. As we get older, that blood-brain barrier thins, and so medications are more likely to reach the brain. Additionally, our liver's not breaking down medications as effectively. Our organs are just getting a little bit older, running a little bit slower. So breaking down medications doesn't happen just quite as fast. Same thing with our kidneys. It's not necessarily clearing medications as efficiently or fast. So overall, drugs kind of just have more effects, more side effects. And so that's why we see for older people often have lower doses of medications, not because, they need less, but because the medications are just working more potently for them. So what are some specific considerations that we're looking for? The big one here is confusion, dizziness, drowsiness. There's a class of medications we look specifically for called anticholinergic medications. I know if you're taking Key's course with public health, I talk a lot about anticholinergic medications there. This is just a class of medications that have a number of side effects that we don't want. So dryness, drowsiness, tiredness, that can increase our risk of falls. And there are also several studies out there that link them to worsened cognitive impairment as well. When we're shopping over the counter, there are several disease state interactions we want to look at, and I should cover those more specifically as we kind of go through the different medications. But the big ones are diabetes, hypertension or high blood pressure, heart failure, kidney disease, any kind of memory issues or cognitive impairment, and then any kind of allergies you have to medications. There are also a few drug interactions with prescription medications that we may be taking. So a good example there is NSAIDs and blood thinners, and we'll talk some more specifically about those when we get to them as well. So if you're looking for a reference as far as medications to avoid as an older adult, there is a really good reference out there. It's called the Beers Criteria. This is just a list of medications that they use to assess for inappropriate drug prescribing for older adults. The most recent update was in 2023. This list is findable online if you're curious about it at all. There are over-the-counter medications included on this list. The big over-the-counter medication you can find on there are antihistamines, or specifically like diphenhydramine or doxalamine. The Beers list, if you see a medication you're taking and find that it's on the Beers list, that really indicates it's kind of a warning light rather than a stop. So if you do see a medication that you're taking on the Beers list, don't just stop taking it right away. But it might be a good time to talk to your doctor about, what am I using this medication for? Is it still necessary? I noticed this on the Beers list. How could this affect me as I get older? So it's just a good resource to kind of keep an eye on medications that we're using at home. All right, and with that, we will get into over-the-counter medications. So we are going to start with allergy medications, specifically starting with the nasal steroids. So there are currently 4 nasal steroids available over the counter. First is fluticasone or Flonase, triamcinolone or Nasacort, budesonide or Rhinocort, or azolastine and Astelin. They're all used to help treat nasal allergies. They all improve nasal inflammation, congestion, runny nose, and sneezing. They're pretty minimal as far as side effects. Some people have a little bit of headache, depending on the inactive ingredients. Sneezing, obviously, because it's a nasal spray, sometimes people find that kind of irritating. And then maybe a little bit of stinging, especially when you are first using it. One caution with the nasal steroids is they can sometimes cause nosebleeds or irritation, especially if they're not used correctly. They might be not quite going where we want them to be. So how do we want to use them correctly? First, you want to try to clear your nasal passages as much as you can. Tilt your head forward, breathe out slowly. You want to insert the nose piece into your nostril, and actually you point outward, not inward. A lot of people kind of intuitively want to follow the direction that their nose goes. You actually want to go outward to where your sinus is. And you really want to go like as far back as you can to really try to get as much of that medication there into your sinus. Take it slow, take a deep breath while you take the spray in. Ideally, you don't want to feel the medication going down the back of your throat. That usually means you got it kind of more into your esophagus instead of into your sinuses where you're kind of aiming for. So, nasal steroids are usually what I prefer to recommend for older adults. They have the least amount of side effects, and I really like them too because they're really focused where the medication needs to go. If you're having allergy symptoms, especially like generalized seasonal allergy symptoms, it's usually there in your sinus. And so you can just use a steroid nasal spray and just works right there. Sometimes people need more than that, and that's where we kind of get into our antihistamines here. This first list is less sedating antihistamines, and the arrow there just indicates the least sedating to the most of those available over the counter. So loratadine is generally the least sedating of those. And then the levocetirizine or Xyzal, that's kind of a newer one. That one is probably the most sedating of the less sedating antihistamines that are available. They all work really well. A lot of people just kind of end up having a preference for one over the other. But if you're finding that Claritin isn't working for you, you can always kind of work your way up that list and see what is. They can also be useful for cold symptoms, hives, any kind of insect bites, itching type of thing, kind of generalized symptoms. It can be worth using antihistamine for. Antihistamines that we do want to avoid as we get older are these first generation or the more sedating antihistamines. This class of antihistamines just tends to get more into or cross more of our blood-brain barrier, get more into our brain space. And so we don't generally recommend those for older adults just because they have those anticholinergic effects that I was talking about. So confusion, drowsiness, dryness. You overall feel just kind of tired, and that's like a medication-induced tiredness. So your risk of falls increases. And then, like I said, there is quite a bit of studies out there that indicates that it can also worsen cognitive impairment. So besides over-the-counter options, what are some non-medication options that we can use for allergies? If you like spicy foods, that can help clear congestion. Otherwise, using honey, that can help soothe a sore throat. Especially if you get local honey, a lot of times that is made from local pollens and can also sort of help allergies if used long term. So certain foods definitely help with allergies. Drinking water, I think that's going to come up for every class of medications that we talk about. Make sure you're drinking plenty of water. In this case, it helps thin that the mucus in your nasal passage, helps it drain a little bit more easily. Using an air purifier or a HEPA filter, just keeping our air nice and clean as much as we can, especially in our homes. You can use a saline solution, or they do make little bottles of saline solution that you can use to clear the sinuses. If you do have a neti pot at home, just making sure that you're using like sterile or distilled water with it, not tap water. Depending on where you are, the tap water is not recommended for using in neti pots, but that can definitely help, and that's a non-medication option. And then just general avoidance of allergens. Pollen counts are highest in the morning. That's usually kind of the nicest time to be outside, but also when the pollen counts are highest. So just avoiding being outdoors during that time if you can. And then if you do want to be outside but try to kind of minimize that, you can wear like a dust mask, or I know we all have kind of a lot of masks left over from COVID, just to kind of physically block out those allergens from getting into our sinuses. So overall, first choice for older adults would be the nasal steroids, our Flonase, our Nasacort. Probably if you do feel like you need an antihistamine, one of those second generation antihistamines is probably your best choice. Like I said, any of those is appropriate. They do still carry a little bit of risk of those confusion side effects, but it's much less than those first generation antihistamines, those diphenhydramine, doxylamine. Those really notoriously have strong side effects, confusion, dryness, drowsiness, that just cause all sorts of problems that we can avoid by just not using them. Watching the pollen counts and staying inside when the pollen counts are elevated. We're getting to that time of year. I know I'm going to start watching the pollen counts any day now, especially those couple of warm weeks we had in February. I was kind of like, oh, I have to get my antihistamines out early, I guess. And then if your allergies don't improve with any of the over-the-counter items, or you have any kind of signs and symptoms of an infection, you do want to go see your provider and have that checked out right away. So moving on to sleep aids. It does seem like a little bit of an odd transition, but there is a reason for it. There are a couple of over-the-counter sleep aids that they make. What I really want to point out here is that, your Tylenol PMs, Advil PMs, all contain the pain reliever. So Tylenol has acetaminophen, Advil has ibuprofen, but often they contain a first-generation antihistamine. They're taking advantage of those side effects of the first-generation antihistamines, the drowsiness, the tiredness, all those side effects to induce sleep. So if you look carefully, and I tried to pick examples here where you could see really clearly on the box that, it's a pain reliever plus a first-generation antihistamine. So generally, these are not recommended for older adults because of that first-generation antihistamine that is used to cause sleepiness and those anticholinergic side effects. So if you see PM on it, it's probably not a good idea to pick that up from the pharmacy. One thing that you can consider if you do feel like you need something to help you sleep, you can definitely try melatonin. It doesn't have those side effects like those first generation antihistamines like we talked about it. The evidence is a little bit mixed, but I'll tell you that I personally use melatonin sometimes if I need to sleep, and I've heard a lot of things from people, and that's usually our initial sleep aid of choice here at the hospital. A recommended starting dose is 2 to 3 milligrams nightly. It just kind of depends on what size tablets you can find at the pharmacy. The recommendation is to take it probably 2 or 3 hours before bedtime. So that's when your body's naturally making melatonin to help induce sleep. And so taking it as an early part of your bedtime routine should help you feel tired by the time you're ready to go to sleep. With melatonin, since it is sedating, you do want to avoid taking it with any other type of sedating medication or substance. And then definitely, again, because of the sedation, don't drive or anything until you know how you feel while you're taking it. So sleep aids, this is probably the really important slide for sleep aids, just non-medication options for sleep. Good sleep hygiene is the number one thing you can do, especially as you get older, to help with sleep. So having a bedtime routine, doing the same things every night before bed will kind of trick your body into feeling tired around the same time. Sleeping in a cool and dark room around like 68 degrees is kind of optimal to help you sleep well. Avoiding screens close to bedtime. I know I struggle with this one, but if you can avoid screens like at least 1 or 2 hours before bed, your sleep will definitely improve. Exercising regularly, avoiding eating meals within 2 hours of bedtime. So a large meal right before we go to sleep usually gives us less good quality of sleep. Limiting daytime napping or limiting napping at all is a good choice. And then avoiding any kind of caffeine, alcohol, or nicotine right before bedtime. Any kind of little bit stimulating substance before we go to bed isn't going to help us sleep. And then if you find that you can't sleep, don't watch the clock. That generally doesn't help. If you can't fall asleep, you usually just feel frustrated. Instead of watching the clock, usually if you can't fall asleep within 20 or 30 minutes, it's good to just get up, take a break, have a glass of water, and then kind of try again in 10 or 15 minutes. So in summary, sleep hygiene is really the best thing you can do to improve sleep. You can definitely try melatonin. Some people it works great for, some people don't think it works at all. But really just avoiding those PM medications for sleep, those can be really harmful for your cognition and just make you feel kind of crappy and tired all the time anyway. If you're having ongoing sleep issues or another sleep condition, definitely talk to your provider about sleep. All right, off to cough and cold. So cough and cold medications are basically separated by symptom. So first we'll start with dry cough. Dry cough is basically dextromethorphan is what you're looking for over the counter. They make an immediate release or Robitussin, and they make an extended release, which is Delsum, which is a great product to use like overnight to help suppress cough. Basically, if you're looking around over the counter and the product says DM on it, that's generally an indication that it has dextromethorphan in it. They do have tablet versions. I do just caution if you have diabetes, the syrup form is usually pretty high in sugar. So if you're using that, just to be mindful of that. And then please just always use the provided measuring device when you're taking cough. Know exactly how much you're taking and when. For wet cough, the ingredient we're looking for is called guaifenesin. And that's an ingredient that will kind of help loosen up that chest congestion and then make it easier to cough up. So the word we use for it in the pharmacy is expectorant. Take it with plenty of water. Water also helps loosen up that chest congestion and make it easier to cough up. And then same thing with the cough syrups. They have a lot of sugar in them. So just be mindful of that, especially if you have diabetes. And then using provided measuring devices when you're taking cough syrups. On to congestion. So there are two main ingredients that are still available over the counter for congestion. First is pseudoephedrine or Sudafed. That one you do have to buy behind the counter because we probably all know by now it can be used in large quantities to make methamphetamine. So they do kind of try to limit the amount you can buy behind the counter, but it is still technically an over-the-counter product. You do not need a prescription for it. If you're looking for a product with a D in it, so like Claritin D, Mucinex D, D is generally an indication that there's a decongestant in it, and the decongestant is usually pseudoephedrine. Phenylephrine is also, that one is not restricted to purchasing behind the pharmacy counter. We'll talk about phenylephrine a little bit more in one second, but that is also an over-the-counter decongestant that is still available. Both these products are fairly stimulating, so if you do choose to use them, taking them earlier in the day is the best idea. And then if you have high blood pressure, both of them will increase your blood pressure. They both work by restricting blood vessels, which helps with our decongestion, but then also raises our blood pressure. So we don't like that. And then again, because we're restricting our blood vessels, if we have diabetes, then it might make our blood sugar go up as well. So last year, the FDA came out and said that actually phenylephrine doesn't really do anything. It's not better than placebo. If you have a phenylephrine nasal spray, that is still considered effective, but the tablet form, the type you find in like a PE type of product over the counter, it's just not really worth your money. It's not harmful or unsafe, although it does have those same side effects with the high blood pressure and the increased blood sugars, but it's not harmful like in of itself. Last I checked, the FDA is still currently deciding whether or not to remove these products. So, not worth your money. Nasal sprays. They do also make nasal sprays for congestion. Oxymetazoline or phenylephrine nasal spray, which again is still considered effective per the FDA. In my opinion, these are better options for patients who should not use oral decongestants. So if you're not, if you have high blood pressure or you don't want to be awake all night, nasal spray for congestion is a good option. It is a little bit controversial among providers, and that is because it does have a limit. You should only use it for probably 3 or 4 days at a time, and that's because basically your nasal passages kind of overcompensate and swell up as you're using it, so then you can have this rebound congestion, and so ironically, it can make you more congested if you use it for a long time. So if I'm using it, it's generally like if I have a cold and I'm getting ready to go to bed, but I still have like a lot of congestion, then 1 or 2 days, I might use a nasal spray, but they work really well for what they do, just limit to a short time. Cold prevention, there are cold prevention products out there. Zinc, echinacea, vitamin C. These products are generally really popular. I don't usually recommend them. They are technically considered herbal or supplement products. They can have drug interactions with prescription medication, especially that echinacea that's in Airborne, and then the effervescent tablets specifically. If you have a heart condition or heart failure, they're generally really high in sodium, so you just want to be really careful, that a supplement that you're using isn't adding a bunch of excess sodium to your diet. So the evidence is kind of really mixed whether they really do anything. So you're better off just, saving your money. If you think vitamin C really helps prevent colds for you, there's lots of great dietary sources of vitamin C, oranges, healthy fruits and vegetables. You're better off spending money there. So since we're on cough and cold medications, I feel like this is where probably these combination medications come into play the most. If you take a medication that only has a single drug in it, you're basically only taking what you need based on your current symptoms. And usually you can combine them if you have multiple symptoms. So, if you're having congestion and cough, you can take your Sudafed and your dextromethorphan, just take them at the same time. You don't necessarily need them as a combination product. I found that over the counter, the combinations often contain 1 or 2 ingredients that you really don't need, you're not having symptoms for, they're just kind of extra stuff in there. That's probably not great for you. Cold and flu medications especially notoriously have first-generation antihistamines in them. And again, that's our anticholinergic effects, our dryness, our confusion, our tiredness that we're really trying to avoid as we get older. And then combination products almost always contain acetaminophen or Tylenol. And we'll talk about Tylenol really shortly here, but it can make it really easy to accidentally go over our daily limit of Tylenol and possibly be taking too much. So up here I have an example for, this one's NyQuil Severe. This one's probably most egregious, the most egregious example of a product that, maybe we have a cough or we're feeling a little bit like we have cold symptoms, but then in addition to our dextromethorphan for our cough suppressant, we do have Tylenol in there. We do have doxalamine, which is one of our first generation antihistamines. And then we also have phenylephrine for decongestion, which now the FDA is saying doesn't do anything. So basically like 3 ingredients that you don't really want or need for a cough product that you think is just gonna suppress your cough. So what are some non-medication options for cough and cold? Again, making sure you're drinking plenty of water or fluids. Maybe you don't feel like drinking water, but even just getting hot tea, chicken soup, broth, kind of any way you can pack fluids in is really ideal. Just rest. For decongestion, humidification, just standing in a steamy shower really helps with congestion. And then again, with our saline nasal sprays, or again, you can buy like a little saline nasal sprayer over the counter. They're really cheap. If you have a sore throat, doing a salt gargle will also help. So in summary, if you have a dry cough, you're looking for an ingredient called dextromethorphan. If you have a wet cough, you're looking for an ingredient called guaifenesin. You may choose to use a nasal spray instead of an oral decongestant. Just make sure you limit that to just a few days. If you're using saline nasal spray, you can use that like basically unlimited. Just make sure you're drinking plenty of fluids and getting plenty of rest. And then if your symptoms worsen or you develop a fever, that's when it's probably worth talking to a provider. All right, on to GI. So, heartburn. These are our main over-the-counter options for heartburn. The fastest acting one is probably our antacids or our Tums. There also are shorter acting tablet medications, cimetidine and famotidine. I don't know if anybody remembers Zantac or ranitidine. That one was recalled in 2020. So if you still have Zantac at your house, it's a good idea to throw it out. That was recalled because they found over time the drug developed a product called MDMA in it. And that was a potential human carcinogen, so they just took it off the market completely. So if you have Zantac at your house now, it's probably expired. Definitely worth getting rid of now. And actually, famotidine has been rebranded as Zantac 150. So you can still buy brand name Zantac. If you need kind of a longer acting heartburn choice, there are a few. They're called PPIs, or proton pump inhibitors. Omeprazole, lansoprazole, esomeprazole. Those are the 3 main options available over the counter. You do want to be careful if you're taking Plavix or clopidogrel. That has a pretty significant drug interaction with those. So if you're on Plavix, just make sure you talk to a doctor before using one of these so that they're aware that you are. For gas or flatulence, there are a few options out there. There is simethicone or Gas-X, as we all know it. There's a product called Beano if you have issues with high fiber foods or like oligosaccharide foods, just basically beans. That's why they call it Beano. And then the lactase enzyme or Lactaid, that's basically an issue with lactose containing foods or dairy. There is kind of mixed evidence on how well these work. And generally, if you're already feeling the effects of the food, taking it after you eat is usually not that effective. You have to take them all before you eat. So you kind of have to know that the food is going to bother you if you're going to use one of these products. But a lot of people use them. A lot of people like them, and they are available over the counter. Diarrhea, there's also a few options. Loperamide or Imodium, I think we all know pretty well. That works very well for like a traveler's type diarrhea. Pepto-Bismol, I don't think you'll find any pharmacists really recommending Pepto-Bismol to people. First of all, because it can make your tongue turn a little bit black, make your stool turn a little bit black. One of the symptoms of having an internal bleed might be that you have a dark, tarry stool, so that can kind of mask that. And then Pepto-Bismol also has a lot of pretty significant drug interactions. So it's out there, but you probably won't find any recommendations for it. Probiotics can also help. Especially if you're taking an antibiotic, using a probiotic along with it can definitely help with some of those diarrhea type side effects. Over the counter, there's a couple refrigerated items. I usually recommend those just because that kind of helps the bacteria last a little bit longer in the tablets, or Florastor is what we have or have had here at the hospital. So for constipation, I have a couple slides here on constipation, and I kind of have them from like what you should try first to and kind of how you should proceed from there. So if you're kind of starting to noticing that you have constipation effects, probably trying one of these bulk forming agents or a fiber supplement is a good place to start. So there's like Metamucil, Fibercon, Citracel. They're usually all like mixed in drinks. And they're really good ways to just get extra fiber and see if you can get stuff moving there. Probably the next thing to try is a hyperosmotic agent. Basically, it just draws water into your colon to kind of soften up your stool. Miralax is the big example of that. I recommend Miralax all the time at the hospital. I think it's a really great product. It works really well. It's really easy to take. You can dissolve it in any type of liquid you want. Just if it's cold liquid, it dissolves a little bit slower, but it'll still dissolve. So stool softener Miralax is definitely a choice that you can take advantage of. Glycerin suppositories are also available. People just generally don't like using those because of how they have to be administered. Stool softeners, there's also Docusate. That's a stool softener kind of in a capsule form. If you've kind of exhausted all types of like fiber, increasing your fiber, trying to soften your stool, and it's still kind of not moving, that's when you should probably turn to a stimulant laxative. So Senokot, Dulcolax, they all kind of work equally as well. You just want to try to limit it to short-term use. Sometimes your body can become kind of dependent on them and then only really want to go if you're using them. So short-term use is definitely recommended unless your provider has told you otherwise. Other choices for constipation over the counter, there's mag citrate and milk of magnesia. Be aware if you're constipated, there are a lot of medication causes of constipation. A lot of these are these anticholinergic medications that we talked about, and it's mainly that dryness that they cause. They cause you to be really dried out, which can cause you to be constipated. So there's like anticonvulsant medications, antidepressants, antihistamines is a really big one that can cause constipation, especially those first generation antihistamines. Pain medications, especially narcotic pain medications, can cause us to be constipated. And then lots of other, these are mostly, the rest of these are prescription medications. So what are some non-medication options for our GI issues? Again, drinking plenty of water. That comes up pretty much always on our non-medication options. Having a balanced diet, especially a diet with a lot of fiber, can help with constipation. But yeah, including those like green leafy vegetables and fruits is really important too. I've read a couple studies on kiwi fruit specifically for constipation, so more to come on that. And then just thinking about, what might be the cause of the constipation and specifically medication causes of constipation. Diarrhea, again, making sure we're getting plenty of water, plenty of electrolytes to replace those that we lost. Just be careful of the sugar in electrolyte beverages. There's actually a lot of good low sugar beverages on the market now. You can use Pedialyte. It's not just restricted to children. Pedialyte's like a great electrolyte replacement option that is very low in sugar. Liquid IV has a sugar-free option. Gatorade has a sugar-free option. all work equally well. Flatulence, really the best thing you can do is just kind of avoid the offending foods. And then there is some evidence that eating more slowly helps also just with your digestion. So in summary, you can use famotidine, cimetidine, or Tums if you have short-term reflux symptoms. If they're kind of ongoing, they're not getting better with those short-term options, you can maybe try a 1 to 2 week trial of the omeprazole or the lansoprazole. It's kind of convenient. They come in 1 or 2 week packages, so like 7 or 14 tablets. You can buy a pack just for use. If you're having a lot of gas, just eliminating those offending foods. Trying fiber supplements or Miralax is a really good idea before starting down kind of that stimulant laxative pathway. And really, if that's ongoing, you do want to talk to your provider. Always making sure we're drinking plenty of water. And then for any of these conditions, if your symptoms are ongoing or worsen, then it's time to see a provider. All right, pain and fever. So Tylenol. Tylenol or acetaminophen is usually the most recommended pain medication for older adults. It has less drug interactions, it has less disease interactions than kind of our other option, which are the NSAIDs, which we'll talk about in a second here. Tylenol, I feel like, is excessively and unnecessarily confusing. There are many different forms and many different strengths of Tylenol. So if you're buying Tylenol over the counter, just make sure you know what you're getting. There's regular strength Tylenol, extra strength Tylenol, Tylenol arthritis, and those are all 3 different doses of Tylenol in each tablet. However, if you find a product that says APAP, paracetamol, acetaminophen, that all means the same thing. They all have acetaminophen or Tylenol in them. Really, the only restriction with Tylenol is making sure you're staying within the daily limit. It's really not recommended if you have any type of liver disease, and you do want to limit your alcohol consumption with Tylenol, again, because of the potential liver damage. Currently, the maximum recommended daily intake of Tylenol is 3,000 milligrams, and that's from all sources. So, if you're taking your NyQuil Severe and Tylenol on top of that, just being really mindful where all your Tylenol is coming from. That 3,000 milligrams was recently lowered from 4,000 milligrams, and that's just because they found evidence of more liver damage when taking 4,000 milligrams for an extended period of time. Like I said, Tylenol is very commonly found in combination medications. NyQuil is a huge offender, Dayquil, but even like Excedrin or Alka-Seltzer Plus. Basically, if it's a combination medication, I would look at it, just double check it doesn't have Tylenol in it. Being really careful of our unintentional sources is important. Taking over 4,000 milligrams for, even like 5 to 7 days can start to show on our liver function tests. And then taking basically what equates to about 15 extra strength Tylenol tablets at one time can be a potentially lethal overdose. So really keeping track of how much Tylenol we're taking is important. It is probably the most common over-the-counter medication for accidental overdosages. And again, that's because the limit is so small to cause an overdose, and the amount of products that it's kind of found in is so varied. On to our non-steroidal anti-inflammatory drugs. We have ibuprofen. Ibuprofen's just a little bit shorter acting than maybe our naproxen, which is kind of a longer acting option. So it just depends on how long you want to be covered for that pain, which one of those you might choose. Aspirin is also like kind of less commonly used for pain. It's usually used for heart indications now. All NSAIDs are generally not appropriate if you have any type of kidney disease, if you're taking a blood thinner, or if you're at high risk for bleeding. Now, if you have been told to take an aspirin with your blood thinning medication, that's a little bit different, but don't just start taking one if you're already taking a blood thinning medication. NSAIDs do also carry a stomach bleeding warning. That's another reason that they're probably the second choice for older adults. And that stomach bleeding kind of increases as you age. There's also several other reasons that you could be more prone to a stomach bleed. So if you've had like previous bleeds or stomach ulcers in the past, again, if you're taking a blood thinning medication, if you're taking other NSAIDs or other medications that contain NSAIDs. So again, watching your combination medications, and then having 3 or more alcoholic drinks a day while you're taking an NSAID can also increase your risk for stomach bleeding. So there are a couple products out there for headache. These are both combination products. Generally, our headache products contain acetaminophen, aspirin, and caffeine. This is just my public service announcement that Excedrin and Excedrin Migraine are the same product. Basically, the manufacturer had to have the FDA approve it over again to get the migraine indication on it. So they rebranded it as migraine. But if you look at the package, you can fact check me on this. It's the same ingredients in the same quantities, Excedrin or Excedrin Migraine. The caffeine in both of these products is equivalent to about 1 cup of coffee. So really, if you're at home and you're not able to go out and get, Excedrin, that you feel like you need one maybe for your headache, you can maybe do like a Tylenol and a cup of coffee, and that's pretty close to what an Excedrin is of itself. A cup of coffee, a can of pop with caffeine in it. You can kind of hack it until you feel good enough to go get an Excedrin if that's what you normally use for your headache. For urinary pain, you're looking specifically for an ingredient called phenazopyridine. This is a medication that specifically acts in the urinary tract. A lot of times it's called like urinary pain relief. Make sure you drink it with plenty of water, and it will turn your urine kind of like an orangey color. So don't be alarmed if your urine changes color if you're using this product. This one I just like to talk about really briefly because there are a ton of azo products on the market right now, and probably only about half of them actually contain phenazopyridine. So like cranberry, azo cranberry, azo like feminine balance, azo weight management. Those are all azo, so we think they're for our urinary tract pain, but they actually don't have that ingredient in them, that phenazopyridine, that will actually treat the pain. So definitely one to be really careful of when you're purchasing it. I know I've almost made that mistake before. It's really easy to do. Besides medications, what else can we do for pain? If you're having regular headaches, keeping a diary, then if you need to go talk to your provider, it's pretty easy to have that conversation. You can speak to exactly how many you're having and when. And then kind of keeping track of like foods and activities that trigger headaches is a great idea. Regular exercise, regular sleeping, stress management is important. There's lots of great like meditation apps that you can use if you're into that. Otherwise, if you're actually having a headache, just sitting in a dark room or putting an ice pack on your head, those can help too. For muscle pain, heat therapy usually works really well for people. You can buy heating pads. There's tons of heating pads you can buy like on Amazon, or a hot water bottle. And then just if we have a muscle injury, using that rest, ice, compression, and elevation is something that we can do too to help with that. So in summary, for older adults, acetaminophen is usually our safest choice. Just watch your combination medications and making sure that you're underneath that daily limit of 3,000 milligrams. Probably the only people that should really be avoiding Tylenol are those who have like kind of existing liver disease. NSAIDs are great for inflammation, but they have a lot more drug and disease interactions. And as we get older, our risk for bleeding gets higher anyway. So just keeping that in mind when we're purchasing NSAIDs over the counter. Medications that are specific for headache, they're often a combination of things that you might already have at home. Acetaminophen, aspirin, and caffeine, again, are the 3 ingredients that are in Excedrin. If you're having urinary symptoms, just make sure that you're buying a urinary pain product that contains phenazopyridine. I think cranberry is the one that people buy most of the time thinking it's going to help, and it doesn't actually have any pain medication in it. And then if you have any pain that's ongoing or gets worse, make sure you go talk to your provider. So we've covered the main things that are kind of already available over the counter. I want to talk really quick about a new over-the-counter medication. It's not a new medication, but it is newly available over the counter, and that is naloxone or Narcan. This medication reverses opioid overdoses. There is a program here in Iowa, Naloxone Iowa. You can usually get it low or no cost through this program and get a prescription, but you don't need a prescription. It usually costs about $50 or $60. Last time I was out and looked, it was about $55 for a naloxone. But, if anybody in your family is using narcotic pain medications or you just have them in your house, it's a good idea to have naloxone 2 as part of your first aid kit. People usually feel kind of judged for buying Narcan over the counter, but no one will judge you at the pharmacy. And, if you have opioid pain medications at your house, you never know what can happen. Accidents happen, and naloxone can really probably save someone's life. So it is worth looking into if you take an opioid pain medication or know someone who does. So really quickly here at the end, what are a few other considerations with over-the-counter medications? Some people are really partial to brand names over generics. Generally, the active ingredients and the risk and benefits are the same. The differences are really some of the inactive ingredients. And then a generic manufacturer needs to show that it's therapeutically equivalent to a brand name drug, but not necessarily have the exact same stuff in it. So really, when people ask me, what brand do you recommend? What generic do you recommend? I usually just say whatever is the cheapest. Brand name cost is usually higher because they had to go through all that FDA approval to get it to be generic or to get it approved in the first place, whereas generic can kind of take that and copy it and make a lower cost drug. There are plenty of reasons why you might prefer a brand over a generic, and that's totally up to you, your personal preference. Some people might prefer a generic just because of cost, but some people might prefer a brand because of taste. I know that I've had a friend in the past who really liked brand name Advil because it tastes like Skittles. And so that just made it easier for her to take. There are inactive ingredients. Maybe you're allergic to an inactive ingredient in one or the other. Maybe you just have more experience with one, or maybe your provider recommends one over the other. So there's tons of reasons why you would use one over the other. Really quick about expiration dating. Expiration dating on a medication is just the time when a product is known to be stable when stored properly in your home. So you know that the strength is still there, the quality is still there, and the purity is still there. If you have expired drugs in your home, they might have degraded below the acceptable limit. They might have a lower strength in it than intended. Some of that drug has degraded out. And you might just cause unintended side effects just by the byproducts of the degrading drug. So people ask me about expired meds all the time. Usually what I tell them is, if you have an expired drug in your house, there's no guarantee that it's safe and effective anymore, and you're probably not using it that much anyway, so you're better off just getting rid of it and replacing it. Really quick, storing medications at our house, just making sure that they're in a cool, dry place. Again, checking those expiration dates, and then getting rid of medications that we no longer need or are expired. Being really careful, just make sure that medications are out of reach of children or pets, and if there are children or pets in your home, just make sure that you have the safety caps locked on your medication bottles. So I usually end all of them with just a personal reminder just to keep your medication list updated. Always be sure to include your prescription medications, any over-the-counter medications you take regularly, and then also your ears, eyes, and topical medications. There's tons of paper templates available online if that's kind of how you like to operate. Or I have a couple of recommended apps here that you can track your medications on as well. And there's tons of options for that. This is just kind of what I found first pass through the App Store. So lastly, if you don't remember everything that I talked about here, what are some good resources that you can use when you're trying to buy over-the-counter medications for yourself? Talking to your pharmacist is always a great idea. Getting a recommendation from your provider or physician is great. There's a really great website from American Society of Health Systems Pharmacists, and that's called safemedication.com. That has all of the, the papers that you get when you pick up a medication from the pharmacy, that's all available on safemedication.com, so you can reference that and read through that. Every year, Pharmacy Times sends out a survey to pharmacists and publishes that in their over-the-counter guide. What are the products that pharmacists are most recommending that year? Again, we talked about the Beers list. Those are just medications that are potentially inappropriate for older adults. And then the FDA actually has a lot of good information. That's where I got a lot of information for this presentation. So bottom line, take your time when you're shopping for over-the-counter medications. They change a lot. The pictures change a lot. The labeling changes a lot. I know that, I feel like I know what I'm doing when I'm shopping for over-the-counter medications, and sometimes I feel frustrated or not able to find what I can or what I want. So just taking your time, reading the labels, that's really going to be your best bet when you're shopping for over-the-counter medications. Use all your medications according to the instructions on the package. That's the safest way to take the medications. That's how they're approved. Making sure that you're disposing of any over-the-counter medication or really any medication when it expires. Making sure you're including any over-the-counter medication that you take regularly on your medication list. And really, if you're in doubt, there are pharmacists and providers available all the time for you. I love answering questions about over-the-counter medications. So there is my email there if, feel free to email me if you have questions. Otherwise, I think, we're...
Yeah, I've got a microphone, so raise your hand. But one thing I want to say is you commented about, you covered a lot of information. Use your pharmacists, use your doctors. One of the nice things about our programs now is we record them all. So I was going to say, yes, a lot of information she wanted to cover. So if you feel like you missed something, we will be sending the recording out here in a few days to those of you who are Primetime Alive members. And if you're not, reach out to me and I'll send it to you. But you can watch again or fast forward to those areas where you maybe felt like you missed something.
I bought some, it's called Focus for... it's like Prevagen for memory. What is your opinion? Do you think they work or they don't work?
Is this on now? Okay. So actually when I teach keys to dementia prevention, we actually talk a lot about these different products. Basically like all herbals and supplements, and I didn't have time to talk about that with this presentation, but they actually have different approval requirements than over-the-counter medications. They're actually regulated kind of more like food than a medication. So the studies that they have on them are usually smaller, not a lot of participants. They don't usually have a whole lot of data because they don't need it to make the product available over the counter. So really my opinion is we don't really know usually if they do anything or not. So we do know that healthy diet, green leafy vegetables, blueberries, those all have things that definitely help improve our cognition. So you're kind of better off spending your money on a good healthy diet.
She just bought it today.
Oh,
and you brought up a good point. Could we have you back a time to talk about herbals and supplements?
Yeah, sure.
All right. We like that answer. All right. Here's another question.
Yes, under the non-medication options for sleep, avoid screens close to bedtime. Does that include television?
Yeah, unfortunately. Yeah.
Darn it.
That's probably the one I have the worst time with too. I want to play a little game or something to kind of help wind down. But then, that bright light in your face is really what kind of confuses your circadian rhythm.
I don't know if this is out of your realm, but toothpastes. There are so many toothpastes out there. How in the world are you supposed to know what you're supposed to take? Because you, just like on some of these meds, you turn them over and they're for different things, but they have the very same ingredients and the same amounts. And so you go, okay, what's the deal with this?
So that is actually out of my realm of. But you know what? If you find out, I would also love to know. So.
Okay. I had somebody ask me a question. now this is about prescription medications. You know, you get your bottle, and not all of them do you take every day and use up in 30 days and have to get refill. Sometimes it's an as needed, so you have them around a while. And she said they don't always have an expiration date on those. How long do you keep those?
So generally, the rule of thumb is 1 year from when it was filled is the expiration date on those.
Okay. One year from when it was filled.
Yeah.
Okay. Thank you. All right. Tim, do you have any questions online?
No questions online.
Okay. Okay.
Okay, I want to buy some joint for my joints, and I've been reading and reading and reading, trying to figure out what is the best. What does it need to include?
So the only one that I know of that really has any evidence is glucosamine chondroitin.
Okay.
And yeah, I don't have a whole lot of recommendation on that. That's just the one I probably know best of. I'm sorry, the elevator opened behind me. A lot of times, like a physical therapist or a provider will have a good recommendation on a brand or a type that they found works really well for people. I'm just not that familiar with those.
Okay. Thank you.
So kind of along that same line, but this would be your other program. One of the big things seems like collagen.
Yes. I get asked about collagen a lot, actually, when I do these programs, and I think I just need to read more about it because there's lots of information there must be out there, but yeah, I would also, yeah, that's just something I need to read more about.
Well, I've been taking some for a little while now, like a powder thing. And so, give me a few months, and if my nails are real long and my skin looks great and my joints are all feeling better, I'll let you all know. Yeah, by Halloween time. Maybe by April Fool's Day. Other questions? I have one. All right.
If you're taking the AREDS2, can you also take a multivitamin, or is that too much?
So it's probably not
You
too...
first explain what that is for everybody.
Oh, sure. So the AREDS2, that's like specifically an eye vitamin. So it usually has lutein in it to help with eyes. But it's basically a multivitamin. So I would just check whichever multivitamin you're planning on buying. It's usually not too much, but it just might be redundant. And usually if you get too many of those vitamins, you just kind of like urinate them out. So it might just be money that you don't need to spend.
We've had a physician say it's just expensive urine. Yeah.
I tried to say it the nice way.
And the other thing I was going to say when you were talking about sleep, Dr. Spencer, one of our neurologists who will do programs on sleep, will say, if you tell me you can't sleep, go get the manual to your refrigerator, lay down and read that, and I guarantee you'll fall asleep. So there's another idea for you. Other questions? Let me see here. I'm gonna scoop you.
Okay, so on the Tylenol, there was recommended daily intake, from all sources, don't go over this and whatever. Is there something like that for ibuprofen?
So it's a little bit different because the overdose limit is a little bit higher as far as multiples of our daily limit. So just following what's on the package directions, I think it's usually about 1,600 milligrams, 400 milligrams every 4 hours would be 2,400 milligrams. But if you're following what it says to do on the bottle, you'll be well within those daily limits. So it's not anything you need to panic about. I just highlight it with the Tylenol because it is kind of insidiously in so many products. It's in a lot of combination pain medications as well that are prescription. So, and the threshold is so small. for it to be potentially too much. So that's why I kind of highlight Tylenol specifically and not the other ones. The risk is a little bit lower with those.
All right. Any other questions? All right. And Tim, still no questions online?
No online questions.
All right. Well, wonderful. Ellen, thank you so much. Wow, you had lots and lots of great information today. And yes, we would love to have you back to do
Okay,
a program
perfect.
on herbals and supplements. And so I'll be in contact. But thank you for taking time to prepare and to present today.
Thank you guys all for coming. I had was really beyond my expectations.
This is a great, and we have, good job. We have a nice group online as well. So again, thank you. Thank you for coming out, everyone. I just want to remind you, our next program is Thursday, March 28th, and that's on what goes wrong with the urinary tract. And then probably by the end of next week, you will have an email as well as a flyer about our April through June programs. But I can tell you our first program in April will be Thursday, April 4th on why should I use MyChart, which I think a lot of you know is hooked up to our electronic health record. And there are so many fabulous things you can do with MyChart, not only day to day, but also if you become an inpatient. And we want to really make sure that you understand that and how to use it. And we're going to have people from both Mary Greeley and McFarland Clinic presenting that information. So once again, thank you, everyone, and have a great day.